How would a person know, a family member know, if recovery has been achieved?
Well, recovery from a serious mental disorder, whether it's depression or bipolar disorder or schizophrenia, really means that an individual can come back and live a reasonably normal life. So again, it's really like any other kind of medical problem, and we now know that schizophrenia and other mental disorders are medical, biological problems. One example of normality is being able to have a job or go to school in normal settings, not some kind of a sheltered workshop or some specialized school just for people who have mental illness, but a real job and going to an ordinary school. And one of my patients went to an occupational center, a normal occupational center, and after 2 years of training as a welder, he got a state certificate as a welder, and he's now working as a welder. Another individual went to trucking school, learning how to drive trucks, and now he drives a truck for Starbucks. And so that is one criterion or one dimension of recovery. Another dimension is having friends, and not just friends in a social club for people with mental illness, but friends with whom the individual can go out into the community and do ordinary, normal kinds of recreational and social activities, whether it's going to a party, whether it's going to a recreation center and playing basketball or tennis, or having coffee in a coffee shop. A third indicator that a person has recovered is being able to live independently and to take care of oneself. And the most important part of that is being able to manage his or her own illness. Just like a diabetic has to learn how to take his or her blood sugar samples on a daily basis and regulate the insulin that will keep that person recovered and well and functioning in a normal way. The same thing is true for a person with schizophrenia or depression. They have to know what medication is best for them and to take it every day, to know where the medication is and to be reminded of where it is so that they don't forget, and also what their warning signs of relapse are, because all illnesses, medical, psychiatric, have relapses. If there's enough stress, a person will relapse. And so knowing the warning signs, the early indicators that maybe a relapse is coming on, is extremely important. Knowing what the warning signs are and rating them every day, actually, just like a diabetic would evaluate the blood glucose.
Are there common stress triggers for people?
Any kind of life change can be a stress, and these are stressors that apply to anybody. And these stressors can even be positive things in one's life. One of my patients, when getting married, had an upsurge of warning signs. It was a happy event. She had as her personal goal of recovery was getting married and having a family. About a year later, she had a child, which was another one of the positive things that she wanted, and that defined her recovery and being able to be a housewife and to take care of her family. But that was a stress, even though she was really looking forward to giving birth and having a baby. And then her warning signs came up. And then when warning signs do emerge, it's part of the living independently and managing one's illness to know what to do. Contacting the doctor if the doctor's not available, going to a clinic if the clinic isn't available, maybe going to an emergency room. So all of these things have to be worked out. This is part of the rehabilitation process. Another criterion or another element in recovery is being able to have ordinary citizenship as a member of the community. Voting, for example, would be a type of activity that would define a person as having a normal lifestyle, because normal people do vote.